Are there any risks involved with minimally invasive treatments?
I suppose with whitening, you're likely to get some sensitivity. That's just how you know it's working, really. Usually around the lower front teeth, you get some sensitivity. But even that, after a day, I always encourage people, look, just if it's too much, come back to it. Take a day off, come back to it. People find that once they've got used to that threshold of sensitivity, they come back to it and they're fine. In very rare cases with orthodontic treatment, a tooth can lose its vitality, and so the nerve can die sometimes. But it's not a very common thing to happen, really. And gum recession can happen sometimes. Again, if we call the bone at the front, they call it a biotype. If that's thin, sometimes that can happen. But again, all these things are talked about before. It wouldn't necessarily mean that it's going to happen. It's unlikely to happen, but it can.
And how do you deal with those things if the tooth dies or if there's gum recession?
If the nerve on the tooth dies, then it's likely you may need to have a root canal. It doesn't mean you're going to be in excruciating pain. It can just sometimes change colour, actually. That's normally what happens. It sort of becomes a slightly darker hue or a slightly yellow colour, and then once that happens, then you can usually treat that with a root canal, some internal whitening, and then it's sorted. With a gum recession, it depends on the extent and how much the gum has receded, but you can have things like grafting as well, where they take tissue from another part of the palate and essentially graft that over the area where the recession has taken place. And that's one way of treating that. It doesn't have to be treated though, but that's one way of doing it, if they want it.